I'm a board certified child, adolescent, and adult psychiatrist, and I've helped care for over hundreds, if not thousands, of patients in my lifetime. So, here I want to cover how to help your patients get through pill or medication anxiety. So, you've probably had this scenario if you've been in clinical practice where you prescribe something, you feel like it's going to help the patient, and then the patient comes back and they tell you that they didn't take it because they felt anxious about the medication, or they were worried about side effects, or whatever reason, or it was too complex for them, or they didn't really want to do it. Whatever that reason may be, there's a myriad of them. But the point is that the patient didn't take the medication. And usually it's because they had some level of pill anxiety or medication anxiety associated with it. So, how can we, as prescribers, as providers, account for this and address it ideally ahead of time so that way each visit is productive and fruitful? So that's what I am going to teach you. And I have a 4-step framework on how I like to address this with my patients. So, number 1 starts with validation. Validate. Basically, you want to validate that this is a normal feeling that they're having. So you might experience this either when you make the suggestion, like, hey, I think we should start Zoloft 50 milligrams for anxiety. You might experience it that time, or fast forward in the follow-up appointment where the patient's like, hey, I didn't take the medication at all. So either way, you want to start with validating, like help them realize that this is a normal experience, and like many people struggle through this, and you aren't the only one that is experiencing this, and you've seen a lot of patients go through this. And so you just want to validate that that experience is there, because then now the patient feels connected to you and they feel like you understand them. And because they feel like you understand them, now they are more open to understanding you. So you open your heart up, they open theirs up, and so now you've opened the floor for two-way communication. So the first is validating that. The second is normalizing. Normalize. So you want to normalize the side effects that can happen, because basically it's a normal thing with a lot of these medications. Side effects are probably going to happen. And so having just helped them understand that, okay, this is normal, it's very well studied, it's not, you're not the only one who's experienced this. It's part of usually like that on-ramp journey where people, it stucks near the beginning, but then once they get through that initial period, things get a lot better for them. There's been so many patients, you probably had them too, or if you're not in practice just yet, you will, where the patient's nervous and anxious about it, but then they take the medication, fast forward a month later, and they're feeling much better than they ever had. Going through that story with them, but then also normalizing that side effects is very, very helpful. So that way, the patients don't want to feel like that this is the only thing that's happened to them. So help them understand that this is a well-studied, well-documented phenomenon, and it's a very normalized thing, can really help. So then number 3, so we covered first you validate, then you normalize, and then this is the one that no one ever talks about, amplify. Amplify their pain. So what does this mean? If you've ever had any kind of sales experience or motivational coaching experience, you'll understand that human beings don't make decisions based off of what they want to do. They make decisions avoiding things that they don't want. Pain motivates behavior more than desire does. If someone puts their hand on a stove that's hot, it immediately motivates the action to take it away. Versus if someone is wanting to lose weight because they want to be healthier, that's not as strong of a desire as wanting to lose weight because they don't want their friends to make fun of them or to think that they're fat, or they already got called fat and they're getting bullied for their weight and now they want to stop. So you see, the goal is the same, to lose weight, but the motivation, running away from a negative stimulus, from pain, from bullying, is stronger than the positive. Oh, like, let me do this for my health. So understanding that, if you've ever had any kind of sales experience, which is rare in the healthcare field, but you understand that you want to really help amplify the person's pain, because then when they become aware of their pain, when they become like sitting in it, then that's what will motivate their action. So here you want to amplify, okay, what problems are they having that's motivating them to seek out medication treatment or psych treatment in the first place? Are they having family problems, relationship problems, school problems, um, mood problems, job problems, whatever it is? Amplify the problems that it's causing and really help them to verbalize it, because then when they feel the problems that it's causing and the pain, they feel that pain. You want them to feel the pain. Pain is a tool that's used for motivation and behavior change. Then once they feel that, then their motivation is going to be a lot higher to seek action. This is why numbing pain doesn't really help the underlying cause. So for example, like at least in like, for example, with like young guys, young men who are struggling with motivation, confidence and things, a big problem is that they numb their pain through corn and through video games and junk food, things like that. These are all numbers. So when they take that stuff, they feel like, okay, like life's kind of better, life's okay now. But then that really numbs their pain. Whereas if they feel that pain, that's what will motivate that behavior change. So don't be afraid to really amplify the pain. It's not manipulative, because you're doing it to help the patient overall. Giving the patient empty words, like, you know how like you talk to every person, every normal person when they're going through something, they're like, oh, you'll be all right, you'll be okay, it's going to be fine, like stuff like that, like platitudes. That makes the person kind of feel better in the moment, but it doesn't really help them make change long term. And then number 4, so validate, normalize, amplify, and then educate. The reason I leave this step at the end is because you want them to buy in with you first. You want them to feel, okay, that this is a normalized thing. Then you want them to really amplify the problem that they're having, so now their motivations increase. And then you can educate about outcomes, like about the positives regarding outcomes. So basically you can see like, this will help you to be better at work, or relationship better, or your mood's going to be better, your day-to-day is going to be better, whatever, it's going to help you with that. And the reason I put this last is because it follows all this stuff. Negative behaviors, more positive, more of a motivator than positive. So that's why I started with the negative first. So amplifying the pain. So really identifying the carrot or the stick, but then also giving them that carrot too. So helping them move away from where they want to go, having them move away from the thing that they don't like to the thing that they do want. So you educate them out the outcomes. And then another way to say this is visualize success and help them visualize what it means for them. So this is the 4-step framework that I use to help patients with pill anxiety or medication anxiety. Try it out. I think it will be wildly effective for your patients. And if you want to learn more real life psychiatry stuff like this, more real life psychiatry prescribing details, diagnosing skills, you want to level up your skill set and your confidence, get over imposter syndrome as a PMHNP, as a psychiatric nurse practitioner or a family nurse practitioner, best way to do that is in our psych coaching program, where we've had over 230 students go through so far and really get a lot of value out of this. I will see you in there. And I hope you enjoy this video.